Welcome to the Report of Findings Assessment Training Module for Moody Health Center at Texas Chiropractic College. I'm Dr. Corey Mayon, the Director of Clinical Education, and I'll be leading your module today. Today's module will cover what a Report of Findings assessment is, the questions that you'll be grading, and I'll show you an example of the Report of Findings assessment on the assessment portal. Let's say you're ready to do an ROF or observe a Report of Findings. You'll access your assessment portal and fill out the assessment intro page. Then you'll choose ROF. You'll specify the diagnosis that was given in the ROF. Then there are 5 data collection points that you'll grade on the Dreyfus scale. We'll talk about those soon. There's a note section for you to place anything that you've noticed during the encounter for students to reference later. The 5 scored components are averaged, and the students can access it to find out if they are at or above benchmark. Please remember to give verbal feedback and then document that verbal feedback on the feedback page. Here's a screenshot of the handout that you were given. Each question has a title and a summary followed behind it. Then in the right-hand column, there's meta-competencies linked to each individual question. On the right side of the page, you'll see all of the individual descriptions of the meta-competencies. Here's a basic overview of each question. Question number 1. You're grading the students' skills in their communication with you as an attending. Did they present completely and coherently the case to you before they gave the ROF? Second is their reasoning. Did they use adequate reasoning to develop an evidence-informed diagnosis? Third, their skill in patient education. Did they educate the patient using the appropriate language? Did they use their doctor's words and then their patient words? Next is their considerations. Did they consider the diagnosis, any comorbidities, and/or any co-management required for their condition? Lastly is their conduct and professionalism. Did the student act appropriately? Once you've graded the 5 components, you move on to the feedback page, which you select the assessment ROF. You do a short description of the verbal feedback that was given to the student of what went well and things to work on. If clinical education review is required, you'll type the parameters there and then place your 4-letter verification code that only you and the clinic data manager know. Let's see what this looks like. Start the assessment. Choose your name and the intern you're evaluating. Select the clinic they're enrolled in and then place the chart number. Now pick the case type: alumni, case study, outpatient, outreach, staff, student, or other. We're going to click Other and type Training. We're doing an ROF, so select ROF and click Next. Now, what is the general diagnosis? Let's say that the diagnosis is tension, headaches. Question number 1, attending communication. Did the student discuss findings including diagnosis, recommendations for care, outcome measures, need for ancillary examinations, and prognosis with the attending prior to ROF presentation? These will all be graded in the Dreyfus model. Next, did they use adequate reasoning to come up with a diagnosis? Student made evidence-informed decisions in developing diagnosis or differential diagnosis and patient care plan. Next is patient education. Student explained patient's care plan and covered appropriate ROF parameters, including the need for chiropractic care and/or referral. Skills and consideration. Considering the patient's comorbidities and other health risks, intern ensured patient comprehension of current condition and prognosis. Lastly is their conduct and professionalism. The student acted professionally through appropriate communication, bedside manner, hygiene, and conduct while considering ethnic, cultural, and socioeconomic needs. Once all of these are assessed, click Finish, move to the feedback page. We just did an ROF. Now an example of what went well and things to improve on would be: student moved at good pace. Maybe things to work on would be include other options for care in ROF. There's no clinical education review required. If there is, you would just select the parameters and describe the assignment, and then type in your verification code. Your ROF assessment is completed. This concludes your ROF assessment training module. If you have any questions, please address your handouts, the syllabi, or the clinic handbook. For answers that can't be found, please refer to the following. For clinical operations questions, ask the Director of Clinical Services. For any educational concerns, you can ask me, the Director of Clinical Education, or for any resources you need, please ask the Clinic Data Manager. Thank you so much for your attention.